Welcome to Health Smart, a monthly health education program brought to you by Hudson Valley Hospital Center. This evening we have a guest, a very special guest, Dr. Dr Hon from Westchester Surgical Associates, which practices here at Hudson Valley Hospital Center. Dr. Hon and I are going to have a discussion about colorectal surgery and health. So today, I'll just tell you a little bit about Dr. Hon, then maybe Dr. Hon can tell us a little bit about himself. Dr. Hon is board certified in both general and colorectal surgery and provides specialized colorectal and proctological care. Most recently, he practiced in Manhattan at Lenox Hill Hospital on the Upper East Side. Dr. Hon completed his surgical residency at North Shore Hospital in Manhattan and Long Island Jewish Medical Center in New Hyde Park. He specialized in colon and rectal surgery training, was completed at the prestigious Baylor University Medical Center in Dallas, Texas. He grew up right here in Westchester County. He went to Scarsdale High School, and he attended Cornell University for his bachelor's degree and SUNY Upstate Medical University for his Doctor of Medicine degree. It's great having you on the show.
Thank you, I appreciate it.
Maybe you want to tell us a little bit more about yourself other than what's right here on the paper. Anything you'd like to expand upon?
No, not really. I'm very excited to be here at Hudson Valley Hospital Center and working with Northern Westchester Surgical Associates with Dr. Gordon. I'm very excited to bring colon and rectal surgery to the hospital and the community that it serves, and as well as perform acute care surgery for all its patients.
Right, absolutely. So tell us a little bit about how you got into the field of proctology and colorectal surgery. Why did you choose this field of medicine?
All right, that's actually a really common question that my patients ask me. There's a tremendous taboo associated with the area, and everyone thinks, wow, it's kind of weird, but when problems bother people down there, they can be very debilitating. And really, people don't like talking about it. There's sometimes feelings of shame, but I find people to delay seeking expert consultation until much later in their disease courses for what could have been treated much earlier. So, going into this field, I tell people I love colon and rectal surgery because I see patients of all ages, young and old, male, female. Anyone can have colon and rectal or proctologic issues. And I explain to people that it's just another part of the body, that can get sick.
Right, that's a great way to look at it. I was just going to ask you that because, it seems to me that there's probably a lot of people who are just very embarrassed to, just even talk to their primary care physician about some problems that they may have, whether it's, hemorrhoids or just, general problems, and that, they really need to sort of be more forthcoming and get help earlier on. So what are some of the issues that patients come to you for, and how do you usually get your patients? Is it usually somebody goes to their primary care physician, or do they come directly to you, or how does that?
There's many different ways that patients can see me. They can see me in my office in Putnam Valley, or they can come to Hudson Valley Hospital Center. I'm always available. If their problem is urgent or emergent, they can come to our fantastic no-wait emergency room, and I'll be happy to see them there. If it's more of an elective problem, they want to see me on their schedule, right, I'm happy to make an appointment with them at my Putnam Valley office. Great.
So, what are the types of things that people come to you for, and how does somebody really know, like, okay, it's time to see the doctor for this. This isn't, right, something I can treat myself.
Right. What I find is that typically people don't necessarily know where to go. So oftentimes they go to their primary medical doctor first, and their primary doctor may make a referral to come see me. They may see their gastroenterologist, who may refer them to see me as well. Common complaints, a lot of people come to me, quote unquote, complaining of hemorrhoids, but to me that can mean anything. So I try to break it down by, their symptoms, whether they're having pain, bleeding, itching, burning, or swelling, whatever the symptom may be. and then go from there. And you know, I see a lot of complaints. Common ones would be, you know, hemorrhoids, anal fissures, perirectal abscesses and fistulas, pruritus ani. Those are very common colon and rectal complaints.
Right, right. So, I mean, a lot of times, though, the problem stems from something, you know, higher up, or something that's part of a systemic, you know, problem, and not like people might just see it as like, oh, I have a hemorrhoid, as you said, you know, when really they might have like diverticulitis, or they might have some other, you know, more complicated condition that needs to be treated in a more holistic way. So, I mean, what is diverticulitis, and what are some of the,
diverticulitis is really the inflammation of diverticula, which is really common in the Western world, because we typically eat diets that are inadequate in fiber. You won't find this problem as common in places where they do eat a lot of fiber. It's thought that this is a disease of, you know, chronic constipation and our go type American lifestyles. Right. So diverticulitis is inflammation or an infection of these diverticula, which are little pockets in the colon. They're treated with antibiotics, sometimes may require surgery, but ultimately that's a discussion to be had with the patient and their medical doctor, gastroenterologist, or me, the surgeon.
So would you perform that type of surgery, or is that a gastroenterological?
Right. So I do perform surgery for diverticulitis.
Right.
And every patient is treated differently. Some people just need changes in their diet. Some people need surgery. It ultimately depends. But just because I'm a surgeon, surgery is just another tool for me in my toolbox. A lot of patients don't need surgery for diverticulosis or diverticulitis.
Right. I mean, I think that's something that people sort of get scared about immediately when you have the title surgeon. It's
Right.
kind of like, immediately I'm going to need surgery. I'm going to have to, you know, go into the operating room. Well, that's, you know, too scary. But that a lot of times people do go to see surgeons and there's no surgery involved. It's just,
right. I feel as a physician, my job is to inform and counsel the patients, give them information so that they can make an educated choice about what they want done.
Right.
And you know, I really like empowering my patients with this type of education. You know, I find that it's really important to use terms that they understand, try to explain stuff that, you know, they can understand, and work with them.
Right, absolutely. So just going back to diet, when we had discussion about diet a little bit, it would seem to me that that's a really important part of your practice, because I think that it really, you know, affects what you do. So, I mean, how do you counsel, you know, patients about their diet? Do you refer them to like a nutritionist? Do you, you know, what do you find is the resistance with them?
Depending on the nature of their complaint, overwhelmingly, a lot of problems are caused by inadequate fiber, at least the ones I see. So I personally counsel the patients about the importance of eating fiber, how it can affect them. And then I also talk about different ways to increase their fiber. You know, giving a patient an abstract number like 30 grams of fiber a day, you know, I find is inadequate. You know, I'll try to take them through various strategies to accomplish this goal so that they can hopefully avoid surgery.
Right. Do you, you know, we have a new teaching kitchen here at Hudson Valley Hospital Center that Surgical Associates is actually helps to sponsor, and we have been doing, you know, classes with patients there to sort of teach them about healthier eating and, you know, how to do things like get more fiber into your diet and what is fiber or whatever. So, you know, I mean, do you speak to them about, you know, not just like, okay, you need to eat a fiber bar, you know, you need to, you know, what fiber is, and is there more knowledge involved there, or is it really just?
It's different for every patient. Some people can do it through their diet. Some people need supplementation. So it's a lot of trial and error, and trying to figure out the best way to maintain compliance so that they are staying on that fiber diet, that it is something doable.
Right.
So that way they can sometimes avoid surgery for their problem.
Right. Yeah, I mean, you do see a lot on television now about, you know, diets and yogurt that helps you with,
Right.
you know, probiotics and,
Right.
you know,
I think those are all great.
fiber supplements and.
Something, you know, that I see on television sometimes would be like colon cleansing. You know, I don't think that's really necessary. I feel that, you know, just tweaking the diet can
Right.
really go a long way for a lot of patients.
Yeah. So, you know, we haven't touched upon, you know, the whole idea of colonoscopies and screening for colon cancer. That, you know, colon cancer is one of the top, I believe, cancers, right, that affect people.
That's right.
And, you know, I think now there's more awareness about the need for a colonoscopy. But maybe you can tell us a little bit about what a colonoscopy is, you know, who should get one, how often.
You know, colonoscopy is a procedure where overwhelmingly in the United States you go to sleep for, so you don't feel it at all. Typically patients say that they had the best sleep of their lives. You know, it's a procedure. Once you go to sleep, either a gastroenterologist or a colon and rectal surgeon will place a long camera from your bottom, and the goal is to look all the way around inside your colon to find out, you know, what's going on the inside. And sometimes people can have polyps, and the goal is to remove polyps to hopefully prevent colon cancer from forming. Because of this movement, it's been shown that colon cancer is on the decline.
Right.
So it's a relatively safe procedure that, at minimum, patients should start getting at the age of 50. But what some people don't know is that if they have problems at a younger age, like bleeding, change in bowel habits, pain, that's the time to seek expert consultation, and then a colonoscopy can be warranted earlier.
Mm-hmm. So if they have, like, let's say, a family history as well.
Absolutely.
Of colon cancer or
Mm-hmm.
whatnot. So is there any new research in this field? Is there anything new in terms of screening? I know, you know, I've heard people talk about virtual colonoscopies and the pros and cons of having those as opposed to the traditional colonoscopy. And
Right. What a virtual colonoscopy is, it's a way to examine the patient's colon with a CT scan. It's not as sensitive as a colonoscopy. What that means is that it doesn't pick up the small polyps as much. And the problem with the virtual colonoscopy sometimes is that if you see something, you can't necessarily do anything about it. Whereas with the colonoscopy, there are devices you can place through this camera to remove the polyps. Mm-hmm. So the worst part about a colonoscopy is really the night before, when patients have to drink a bowel prep. The reason they have to drink this prep is this allows them to clean everything inside their colon.
right.
But there are a lot of newer preps out there that are a lot more pleasant for patients, you know, with less nausea, less volume to drink. And again, that's a conversation for them to have with their gastroenterologist or colon and rectal surgeon.
Right. Right. Yeah, I mean, I had heard about, you know, the virtual colonoscopy and, you know, the fact that, well, you know, if you do find something, then you have to have one anyway.
Right.
So it's kind of like you have to do two procedures instead of one procedure. And
Right. Some patients I do send for virtual colonoscopy. It depends on the clinical situation. However, for a virtual colonoscopy, you still have to do that bowel prep.
Right.
There's no getting around it.
Right. So exactly, what's the point? So what exactly is a polyp, and is that something that will definitely turn into cancer, or is that something that a lot of people may have and go around with them and not even know it, or?
You know, there are different types of polyps. Some are, you know, just bumps on the inside of your colon that are completely benign and have no malignant potential. some polyps are thought to be precancerous. What that means is that if they stay there and remain untreated, which means removed, they can possibly become cancer in the future. So it's important to have a good endoscopist look at all this and remove the polyps as necessary. And ultimately, depending on the size of the polyp, how many polyps one may have, really dictates the interval between colonoscopies. So ultimately, that's a discussion to be had on a case-by-case basis with the patient and physician.
Right. So if a person does have colon cancer, how is that treated? Do you perform surgery? Is this chemotherapy? Is it involved with the cancer center? How does that work?
I'm very excited to come to Hudson Valley Hospital Center and bring my specialized colon and rectal surgery type skill set to this hospital. But it's treated in different ways. It's important to get an adequate staging of the patient. And cancer is usually diagnosed on colonoscopy. Sometimes it can be inferred on CT scans. Surgery is, usually a part of a colon cancer treatment. And oftentimes, chemotherapy is part of colon cancer treatment as well.
Right. So it's kind of a
multi-specialty.
Multi-specialty approach. Yeah, I mean, I think it's very important. The Hudson Valley Hospital Center is very lucky to have you here now, because it's very important for a cancer center and a hospital in general to have a colorectal surgeon, because there's so many different surgeries that need to be performed, and that's a crucial one. So just maybe going back a little bit to, or like earlier in your career, I know you graduated from Scarsdale High School,
Sure.
So you're a Westchester boy, and you basically went off to do your studies and practiced in Manhattan. How is that different? I mean, now you're here and you're kind of in the country, you're in Putnam Valley as opposed to Manhattan and practicing. Do you find that it's different, or people are all the same everywhere, or?
Generally, what I have found is that it's different. This is a smaller hospital, but what I have noticed is that the doctors and nurses here are all high caliber professionals. They're great with the patients. I see it. I think this is a great place to practice medicine. It doesn't typically have the congestion of Manhattan.
Right.
I think it's very convenient for a lot of the patients who live around here. I'm very excited to be here. But, patients, be it whether they're in Texas, Manhattan, here in Cortland Manor, or its surrounding lower Hudson Valley area, they can have hemorrhoids, they can have fissures, they can have the whole cadre of complaints.
Right. Well, the human body is the same everywhere, I guess.
That's right.
So it doesn't really matter. But do you find that you can spend more time with your patients here and give them a more personalized, approach?
Even if I was busy in Manhattan, I would always try to make time for my patients. I think it's really important, not to just, give them a brochure and tell them to read it, but the way I've practiced medicine is to always go through it, treatment plans with my patients, so that both of us have a good understanding of how we're going to proceed. Right. To have proper expectations of, what our goals will be. Right.
Is that a challenge, do you think, for doctors these days to try to find the time to spend with their patients? And
MD stands for make do. And every patient, especially one that comes to me, because there has been so much reluctance to come already. Right. Because of this body part.
Exactly.
I find it extra important to be very sensitive and really make sure that they get all the information they need before leaving that door, and understanding what are the possibilities, whether or not this treatment plan works or fails.
Right. Yeah. As you say,
so you got to make time.
Right. It's probably taken that person, possibly a long time to, work up the courage or the whatever to, go to their primary care and talk about it, and then get a referral and, go to yet another physician to talk about this, sort of very sensitive subject to people. So what kind of advice would you give people who have this, in terms of embarrassment or even in terms of how to, care for themselves in this area, in this part of their body?
The most important thing, in my opinion, is to not self-medicate. It's just to have a professional set of eyes. Look at, examine the problem. I don't discourage my patients from going on the internet and looking up information. I welcome it, so that way we can have a more in-depth discussion, or I can answer more questions for them. But with any kind of problem, it's always better treated earlier. Colon cancer is considered curable if caught early. So it's best to just seek expert consultation early. It gives the patient peace of mind, it gives me peace of mind.
Absolutely. Speaking about the internet, I think it's sort of a double-edged sword. You hear some doctors say, oh, the internet's horrible because people go on there and they, self-diagnose, and then they come to your office with, a whole list of things that things could be, and it's, very, very different. So do you find that happens, or people are?
It's every patient is different, but I use the internet myself, and it's just a wealth of information.
Right.
And if the patient wants to do it, I welcome them to.
Right.
I'm ready to answer all the questions that they may have, and it's important. That's just how things are.
Right.
Me myself, I go on the internet to look up information all the time.
Right.
It's just part of how things are done. So.
Right. Probably some of your older patients don't do that as much. They kind of come to you.
Yeah, young, old, whoever.
Expecting you to, be the all-knowing, person, and that's kind of a different.
But the important thing is, whether the patient's young or old, I always try to give them options, so that they can best figure out what's most important to them in terms of formulating a treatment plan.
Right. Absolutely. So, how does one, get a hold of you? And where you mentioned before that you practice in Putnam Valley. Where exactly is your practice?
It's on 11 Peekskill Hollow Road. Our phone number is 845-526-2080. If a patient has a more urgent or emergent complaint, they can come to the emergency room at Hudson Valley Hospital Center. I'll be happy to meet them there, which is another option. I try to remain very available for my patients. I give patients my email address, so that if they have, a simple question or something, I'm happy to respond to them via email. But it's important that I stress I don't give them my email in this type of situation, because I really need to talk to the patient, examine the patient first, develop a relationship.
Right. Well, we're planning on having you come here and speak at the hospital at a patient education program in October, and that might be a good way to meet you and just kind of ask some questions if the person doesn't want to, come in for an office visit. Maybe they don't have a pressing, problem, but maybe they, have an ongoing issue that they might want to hear about or discuss. So you're going to be doing a talk, correct, here at the hospital?
Yep, shooting for sometime in October. I'm very excited, just to meet the community.
Right. No, absolutely. I think that'll be great for you to come in here and speak and meet people and get a chance to, just kind of talk to them. So that will be on our website, and once we firm up a date for you in October, that'll be on our calendar, so people just can go to hvhc.org, and they can, go on there and see the dates for these various talks that we have. You're not the only one. We have other physicians, and it's kind of like this show. It gives people an opportunity to learn a little bit about a certain medical issue without having to really go to the doctor or whatever. So they watch this show, or they come to some of our medical talks at the hospital, and that's what the hospital's here for is to sort of help educate people as to, some of the health issues that they may have, that it's not just, coming to the doctor when you're really sick and, you need to come to the emergency room, like you said. So, trying to educate people.
Yeah, I think that's very important, is patient education.
So that's good. I know that's something that we value here, at Hudson Valley Hospital Center, and something that I guess physicians are having to prepare themselves for more nowadays than just kind of coming in and treating somebody medically.
Mm-hmm.
There's a lot of advice involved. Have you ever, just quickly before we wrap up, have you ever had plans to maybe visit our teaching kitchen and maybe take a course there?
Absolutely.
And maybe we can have you come and speak about fiber at the teaching kitchen.
And I love to, work on my cooking skills as well.
Right. No, absolutely.
I think it's very exciting. I think it's a great initiative by the hospital.
Right.
Given how important I think diet is.
Right, absolutely, and we're really happy that your practice is helping to support this initiative, because I think it's really important for the hospital. So it's great having you on today
thank you very much.
on
I
the show.
it.
And as we mentioned, your is also on our website, and if people want to give you a call or visit you in the emergency room, hopefully not, they know where to find you.
Absolutely.
So it's great having you on today. Thank
All
you,
right,
Dr.
Thank you very
Hon.
much.
Okay. And we'll return the next week with Health Smart with another physician, another topic, and be well.